Hi everyone, welcome to lecture 12. In this lecture, we're going to talk about prevention as a support. It's going to be really important for you guys to understand moving forward throughout this chapter and this lecture that when we're talking about this, we're not preventing necessarily the person from being present. So in order for prevention to be a support, the person has to be present to be receiving the preventative supports. And there are different types or levels of supports, primary, secondary, and tertiary, that can really help to overall the goal is to decrease the impact of the disability through a support system model. So what does prevention as a support mean? So again, it's not the same thing as ensuring that it doesn't happen at all, that the intellectual disability isn't present. In some cases, it refers to reducing the likelihood that something will happen and or the outcomes related to the diagnosis will be better. So the amount of difficulty they may face won't be as great. And it's really linked to the multifactorial etiological factors influencing the manifestation of the disability. And what it really does is it helps to define and design support planning to prevent or reduce the impact of risk factors and their interactions. And when we go through each of the different levels, hopefully this will make sense. But the real main take home here is that the disability is usually still present, just the impact of it is lessened. And it really helps us be really strategic when we're planning supports for individuals. So let's first talk about primary prevention. So primary prevention, again, the person is still present. We have a person there. But the strategies that we're talking about strategies that prevent the development of the disease, condition, or disability. And this can be done through health or positive outcomes. So again, things should be better. So better health for the individual overall, and overall positive outcomes. So some examples of this would be immunization. So making sure that people have appropriate immunizations, wearing a helmet, for example, to decrease the risk of traumatic brain injury, making sure that there's good education around the use of toxin exposure, so decreasing the likelihood of fetal alcohol syndrome from not using alcohol while you're present. Also lead poisoning, having good education for an individual when they're pregnant about the detrimental effects of lead poisoning. So making sure that they engage in, again, really primary preventative type of services, so that way there's not lead poisoning, the individual then doesn't have lead poisoning, and then consequently intellectual disability. But again, the person is still present, so we're not preventing the life of an individual, but rather these are just really proactive strategies that prevent the development of the disease, condition, or disability. When we're talking about secondary prevention, these are strategies that prevent the emergence of symptoms or disability in an individual who already have an existing condition. So I'm actually just going to go back for a second and clarify. In some cases here, again, the person is always still present, but the disability may not be present at primary prevention. So again, wearing a helmet could lead to a decreased risk of traumatic brain injury, for example. So again, the person is present, but the disability may be able to be preventative through these really proactive and positive health outcomes. So again, the person's always here, but the disability actually may be prevented at the primary prevention level. With secondary prevention, these are strategies that prevent the emergence of symptoms or disability in an individual who already have an existing condition or disease. And these really have to do a lot with screening programs. So it's really important though here that screening programs are directly linked to early intervention. And the screening programs and the direct link to early intervention are part of secondary prevention. So both the screening and the intervention both have to be available and actually have to occur in order for it to be a secondary preventative method. So broad screening for something without supports is not ethical. So again, if we just broadly were to screen everyone in the population, again, for autism, we don't have the resources available to directly link everyone to intervention, or for cancer. So again, this is very targeted screening for people that are at higher risk for something and then directly linking them to intervention. So an example of this is with PKU, for example, and then we know that the effective intervention would be that specific diet. Again, screening for autism spectrum disorders when some of those red flags are there, and then linking to early intervention services. Again, the critical aspect is directly linking intervention to prevent the emergence of a disability with secondary prevention. Oh, and I already gave the examples for you guys. All right, when we're looking at tertiary prevention, these are strategies that reduce but do not eliminate the consequences of a disability or overall functioning. But the goal here is to minimize the effect of the condition or to prevent other complications that might arise. So the emphasis at the tertiary prevention level is on increased overall functioning here. Additionally, part of tertiary prevention is prevention of secondary health concerns. And this can be, for example, with Down syndrome. So individuals with Down syndrome are at a higher risk for thyroid difficulties, leukemia, or heart conditions. So making sure that we screen for those things and then again, prevent secondary health conditions by making sure that we keep an eye on them. Additional physical or mental health conditions that can result from intellectual disability but are not a diagnostic feature. That's really important at this. So again, heart conditions aren't diagnostic for or aren't a diagnostic feature for individuals with Down syndrome, for instance, but people with Down syndrome are at a higher risk for certain type of heart problems. So again, making sure that we allow people access to good screening and making sure that you've got a doctor that is familiar with Down syndrome and those heart conditions and can keep an eye on those things. That's an example of tertiary prevention when we're preventing secondary health conditions for an individual. Prevention of secondary behavioral health conditions, also activity limitations. So again, this could be due to having the disability, they may not have access to exercise, for example. And so making sure that we give them access to exercise. This can really help prevent secondary health conditions that may arise due to decreased activity levels. And then also prevention of secondary social conditions like participation restrictions. So again, we want to make sure that we are providing support so that way we can allow people access to social activities in their community when they might otherwise have participation restrictions. All of these things encompass tertiary prevention. So again, these strategies reduce but don't eliminate the consequences of a disability, but they increase overall function as a product of having a disability. And so an additional perspective on prevention is the idea that if we can prevent secondary health conditions, which is a tertiary preventative method, we can increase the overall quality of life through support planning for the individual with the disability. And I just want to take a second to talk about selective termination of pregnancy and point out that it is not a preventative support. So in order for a support to be preventative, the person has to be pregnant. And selective termination of pregnancy is not considered a support as we're talking about it as prevention as a form of support. So it's really important to note that when you're thinking about this and when your book talks about it, it talks about it just a little bit. And we're not going to get into a huge debate or a huge conversation on this because it's really outside of the scope of this course. And it brings in other topics such as abortion, which have lots of, moral and religious issues and just social issues in general into it. But it's important that, again, the take-home message here is that selective termination of pregnancy, when we're thinking about, is this a preventative form of support? And it never is, and it always is not. So just want to make sure you guys understand the difference between those things. And when we're talking about primary prevention versus prevention of birth, again, it's not primary prevention is, again, that's a support. That's when we can prevent the expression or emergence of a disability. But again, a person is present. When we're talking about prevention of birth, a person isn't present. So then by virtue can't support them. So again, for example, widespread screening for Down syndrome. No, that's not prevention as a form of support. Again, because if the person then decides to selectively terminate the pregnancy, that's not a support. Again, knowing about risk factors in your family history, still having the child, and then putting certain supports in place to make sure that you can either lessen the severity of the disability or maybe decrease the probability that the disability will occur, or maybe the disability won't occur at all, for example. Those are prevention as a form of support. But again, the individual has to be present. So primary prevention almost always involves the continued survival of the individual in a healthier state. So we want their life to be better. So again, a person has to be present. And because, again, this is a really polarized issue, and people have a lot of strong feelings based on their religious and morals and their values, again, I don't think it's an appropriate time to, if it's out of the scope of this course to talk about abortion in general, and whether or not selectively terminating pregnancy when you have a disability is right or wrong. But it is, again, if you guys want to take some time and reflect on that in your own, I think that's, important for you to do. But as purposes of this course, when we're talking again about supports and prevention as a form of support, we're not talking about selective termination of pregnancy. So when we're looking at this then from this ecological and interaction perspective, understanding risk factors is essential for designing supports. When you looked at the various etiologies or causes for intellectual disability, you see that in general, the most causes of intellectual disability do have it's many things interacting. And so it's important to understand how risk factors can interact across the lifespan and understanding the difference between genetics and genomics. So genetics focuses on individual genes and their biomedical effects over time. And genomics looks at everything as this dynamic system that's constantly adapting and changing based on internal and external forces in the environment. And it's important to kind of really think about that you can't address everything if you're not aware of all the potential combinations of difficulty. We know that intellectual disability is the functional consequence of limitations, both cognitively and adaptively, and the demands and expectations of the personal environment. So we need to look at the biomedical, social, and educational risk factors that might be present for an individual and see how we can support them. So maybe we can either, again, decrease the severity of the disability or possibly prevent the disability altogether. So again, when we're looking just from a genetics perspective, this is, again, we know that in general, not much can be done to prevent an abnormal gene from having like an adverse effect, for example, with Fragile X syndrome. But with genomics, this is really, again, looking about how certain genes are activated and others are not. And this really has to do a lot with that diathesis stress model, understanding that some people may be genetically predisposed to develop certain things, maybe like even anxiety and depression, and with certain interactions in the environment can lead to the expression of those things. Similarly, that can happen with certain types of disability as well. So knowing about environmental risk factors can possibly help genetic expression of difficulties or the non-expression of certain difficulties. So prevention supports, again, really important to think about thinking about prevention as a form of support, how has this increased your understanding on the importance of etiology? Again, focusing on supporting the individual and the family to help decrease the likelihood that the disability will be present or maybe won't be as severe. So we're really looking at how to prevent the problem in functioning instead of how to prevent a disease or a disability from occurring. The way to prevent risk factors from causing intellectual disability was to, again, to place this, is to really help put supports in place for the individual and the family. So we want to make sure that we know and screen those that are at risk and provide strategic and individualized supports. And then what we want to do is develop individualized preventative supports that are based off of the multifactorial etiological risk factors that individual may have. And how are outcomes of supports really measured? Outcomes are measured through wellness. So how is the person's overall life better? Do they have a better health outcomes, both mentally, physically, socially, spiritually? And so wellness, that's our overall kind of outcome we want to measure. And this really changes how we look at illness, for example. So if we really think about tables 10.1 and 10.2 in your book give a really good understanding of how, when we understand all the different multifactorial and that all the different risk factors and all the different etiologies and the different etiological risk factors, how can we pair supports appropriately to decrease the likelihood? So again, thinking about a mother that may drink, that may use alcohol, how can we use that information from a multifactorial etiological risk factor standpoint to help support the mother, so then maybe the child doesn't have fetal alcohol syndrome? So again, have a good understanding of those tables 10.1 and 10.2 and kind of look at how it breaks that out to help understand how we can provide supports to help prevent the possible emergence or decrease the impact of a disability. So how do we do this? So we want to develop a comprehensive program, and this is by, first we want to look at all the risk factors and their interactions and figure out how we're going to tackle them, so how we're going to address this. And then we want to develop, or rather describe, prevention strategies. And these strategies should be designed to reverse or reduce the impact of each risk factor and interaction, if at all possible. And then we want to evaluate the program. So we want to, through, again, the formulation of that multifactorial etiologic diagnosis, to provide a structure for implementing primary, secondary, and tertiary prevention strategies. And remember, the prevention of secondary health conditions falls under that tertiary prevention strategy section. So I want you guys now to kind of look at this. So if you read this here, so this says an 18-year-old male with Down syndrome is about to graduate high school. He has received special education services and an IEP since he was in kindergarten. He enjoys being around people and wants to move away from home. Specifically, he wants to attend a special college program for individuals with disabilities 2 hours from home and live in the dorms. He comes from a single-parent household and has 2 older siblings, and they both are already in college. So thinking about this, what biomedical, social, behavioral, and educational risk factors are present, and how might you use prevention to support them? Additionally, what interactions among risk factors need to be taken into account? So if you want, take a second, read this over, think about it, maybe jot down some of your ideas, and then I'll give you guys just a little bit of guidance about what to look for in each of those things. While you're doing that, I do want to mention that you might be thinking, wow, that's pretty lofty to think about an individual with Down syndrome going to college. And there is a really great program that's available at many different colleges, and additionally the University of Wyoming, called Think College. We know that college, and you guys are all in college right now, college isn't just about going to classes, right? There's a lot of social experiences, a lot of practical learning that happens just about how to, if you're a traditional student, how you're entering, early adulthood, and how do you, live in an apartment with roommates and pay bills and all of that fun stuff. So Think College really allows individuals with intellectual disabilities access to all of the different parts of college, including academics, in a really structured and supportive way, but allows them to interact and go to sporting events, live in the dorms, all of that type of stuff. So this stuff is actually feasible, depending on the school that you're at. So now that you guys hopefully have thought about that, when we're looking biomedically, what kind of risk factors would we want to take into consideration and support? So we know the individual has Down syndrome, so there's possible medical complications. So we want to make sure that there are doctor's visits and access to care that's available, to make sure that we have some secondary health supports in place, so that way that we don't have additional medical complications. Socially, you have to think about friends, roommates, inclusion. We want to make sure that we prevent victimization. And so thinking about what preventative supports could be in place so we don't have as many difficulties making friends, roommate conflicts, and also to help prevent victimization. Behaviorally, we want to make sure we find stable employment for this person if he wants to be that, involve him in his new community and give him preventative supports maybe to help with social skills. Educationally, we have to think about this person's involvement in classes. Additionally, maybe some sexual education since they'll be on a college campus and may want to engage in romantic relationships. And then thinking about all of the interactions among risk factors. Again, this could be thinking about the family structure. So he comes from a single parent household, so that could be more difficult for the parent, for that parent to find supports. Funding, what type of funding is available for this program? Not having maybe access to a program that can help support his needs, maybe not like think college. Maybe that they might have difficulty keeping up due to cognitive deficits and may become then depressed and isolated and might drop out and then loses friends and community involvement. So all of these different things also interact. So it's important to consider all of the risk factors for these secondary things that could come up and then think about how we could provide supports in the form of prevention. All right. And then lastly, if you haven't already, make sure you get into that DD waiver document. And I want you guys to think, how's Wyoming doing? How's Wyoming doing from a supports perspective? And are any of those supports listed on the DD waiver? Can they be seen as preventative as a form of support? So what are the strengths and weaknesses of the document based on everything you've learned? And then what are additional things that maybe Wyoming needs to consider based on all of the knowledge you guys have gained about supports and supports planning? So make sure you look over that DD waiver document, have a really good understanding. If you have any questions about it or what any of the language means, please let me know so I can help you. But I hope this really helped, and really check out if you just type in Think College into your search bar or look through the Wyoming Institute for Disabilities WIND, they'll have information on there. And it's really neat to kind of see how these programs really can work for individuals with intellectual disabilities, have access to a college experience that may need to look a little bit differently, but still allow them access to that life experience. Thanks guys for your attention, and I'll see you later.